Good afternoon, and thank you for joining me for our first town hall of 2022. I'm Janice Scott and always proud to be your president and CEO. Once again, we find ourselves in a perfect storm. Soaring COVID infections throughout our region, steadily rising hospitalizations, a bed crunch made worse by a record number of alternate level care patients, and an increasing number of Team RVH members off work due to COVID diagnosis, symptoms, or exposure. It's that severe staffing shortage that is making this wave of the pandemic so challenging. It's sort of been described as a 1-2 punch to hospitals, and I can't stress enough how dire the situation is. It's been a tough 22 months. We have never experienced this type of sustained pressure. The situation is really unprecedented, and we all need all hands on deck to continue providing safe care. So let me begin by thanking you for all that you are doing. I know you're physically and mentally exhausted. Many of you are working extra shifts, and others have been redeployed to areas of greatest need. And I know it can be unsettling as you adjust to working in an unfamiliar area with new team members, different tasks, but we all need everyone to do their part. We're facing an extraordinary strain, and we must be creative in our staffing solutions to ensure patient safety. So thank you for being flexible and of course for working together. So we have a lot to cover, so let's get started. I'm joined today by Nancy Savage, Executive Vice President, Patient Family Experience and Chief Nurse Executive. Also Dr. Mir Korsavani, Medical Director, Infection Prevention and Control, and Regional Physician Lead for the Northern Central Regional IPAC Hub. Daryl Sewell, Vice President, Facilities and Chief Human Resources Officer, and Kathy Clark, Director of Safety, Security, and Occupational Health. So let's begin with Nancy. Welcome, Nancy. On Christmas Eve, we were caring for 12 COVID positive patients. Today, the number is 37. So can you paint a picture of what's happening at RVH? Where's our biggest pressure points and what's our mitigation plan?
Thank you very much, Janice, and good afternoon, everybody. Yeah, the numbers have certainly been oscillating, and even though we're at 37 today, we have been up into the 50s over the last few weeks. So to paint that picture, let's start at the front door with our emergency department. Right after Christmas, we were still experiencing our usual high numbers of patients coming through the emergency department, and we were seeing a steady admission rate of 12 to 15%. We started to see patients with COVID come through our ED as community prevalence increased. But unlike other waves, most of those patients were going to general internal medicine. And as those units became full, and particularly our respiratory unit became full, we had to open RESP 2 or 3 South B as an overflow unit. We have had numerous units on outbreak, necessitating that we maximize the number of beds that we could potentially place and open on all of our inpatient units to assist with flow. As I mentioned, high numbers still coming in through the emergency department, high number of patients still being admitted, and COVID starting to show in our inpatient units. We opened Surge 1 to assist with emergency department flow, and we've had to be extremely creative in our placement of patients, and currently looking at admission criteria for our pandemic response unit. But what has, and you mentioned in your opening remarks, what has been particularly intense over these last few weeks is the growing number of ALC patients that we have in the health center that are unable to transition to the community because of outbreaks in settings like long-term care, retirement home, or other congregate settings. So as we continue to have patients admitted, we're experiencing strain with this ALC gridlock, so the outflow is not the same. This has impacted timely patient flow from ED, leading to increased wait times to be seen in that department and a lot of stress on the staff and physicians who are trying to care for those patients. So that's the emergency department, that's the inpatient medicine units, but that's not where it stops. We're also experiencing challenges in mental health and maternal child program, where positive COVID patients are also being detected. We're in the process of planning a move of our child and youth inpatient unit back to that designated spot on the adult unit so that COVID positive mental health patients can be cared for in an isolated spot. Obstetrics, pediatrics, and NICU have their own unique challenges just because of their own space configurations, and IPAC works with them on an ongoing basis to ensure protection of our patients and staff there. But I would be remiss in saying if that was not a challenge. I'll leave you with one last kind of comment. So that's RVH, but we know that we're surrounded by many smaller hospitals who are also experiencing lots of stress. And any time that they experience stress and can no longer provide the services that they need to provide, guess who they turn to? So I know Muskoka Algonquin, we've had to take and help them with patients both in their cancer, our satellite program there, and our ICU. Certainly, we've had to take patients from OSMH because they have had outbreaks, from GBGH, ICU patients for the same reason, and staffing strains, and now with Collingwood, and in particular with their lab issues that they're experiencing, we're on standby there. So I didn't mention a thing about health human resources. Those are the operations. And you mentioned, Janice, once again, that within the health human resource realm, it's unprecedented with the number of staff and their families who are impacted. I'll leave that there because I know Daryl will address that later.
Thanks very much, Nancy. You really painted a vivid picture of the crisis that we're in. We saw significant pressure in intensive care unit during the last wave. How was critical care impacted this time?
It's a little slower. It's not that they're not impacted, but as I mentioned, general internal medicine seems to be where the biggest pressure was at this point in the wave. As community prevalence has started to increase and we start to see patients come into the hospital, we know that we will eventually see growing numbers in our ICU, but it's been a little bit slower. Earlier on, I would say probably at least a week ago, Corey McKee ran some interesting data, Janice, comparing Delta to Omicron. And I'll just state a couple little facts for you. With the Delta, we always expected that we would have a high conversion rate of patients who were on general internal medicine tipping over into the ICU. So we were curious to see, was the same thing happening with Omicron? It is thus far, our sample size is small, but early data shows that it is higher with Delta than it is with Omicron. And we do have a shorter length of stay that we're experiencing in our ICU with Omicron. For example, 3 days versus 8 days with Delta. So even though we may see volumes of patients in our ICU, the early data tells us that the length of stay should be shorter.
Thanks, Nancy. And in an effort to free up beds and also staff so they can be redeployed within the organization, the province has reinstated Directive 2. And this requires hospitals to defer all non-urgent, non-emergent surgeries, procedures, and most on-site outpatient activity. It's a tough pill to swallow, actually. So, Nancy, how is this directive impacting RVH?
Yeah, you said it perfectly. It's a tough pill to swallow because this is not our first time at doing this. And so we complied, obviously, with the policy, with the directive that came out. Our surgery program worked with all of their divisions to ramp down services. We're currently running about 36% of our OR capacity, so that's 3 rooms plus a trauma room. We have 11 ORs, as everybody knows. With regard to ambulatory care, we did an assessment of every single clinic. We've had lots of lessons learned from previous waves. We don't want to be foolish and shut down all clinics because, number one, it has a detrimental impact to those patients who need to be seen. And number two, they'll just show up at the emergency department, which doesn't serve the purpose at all. So we've done an assessment, as I mentioned. We know the patients that need to be seen in person, they continue to come. Those that can be seen safely, virtually, they will be there. Some cases, it's a hybrid, it's both, and then other clinics can be deferred and with a constant reassessment.
Thanks, Nancy. Now, Nancy, both you and Dr. Tyberg sit at the Greater Toronto Area Incident Management System table. And this obviously provides you and Jeff with an opportunity to get a real bird's eye view of what's happening south of us, and particularly in that highly populated area of GTA. So is what RVH is it unique, the challenges we're facing? Or are you seeing it in other places?
Absolutely not. We're not unique. Actually, I would say to all of our team RVH that we have many centers who are much more pressurized at this point in time than we are currently. And when I say that, just the number of COVID positive patients that they have within their hospitals, the number of ED no bed admits are astronomical, all things being relative. And then the number of staff that are off is making it a very tenuous situation, as we too are experiencing. And so in that regard, we're all in the same boat.
Thanks, Nancy. Just a little bit further on the GTA IMS. So last spring, RVH played a very significant role in keeping the system functioning by receiving 220 patient transfers from the GTA. Do we expect the same volume of GTA transfers during this wave?
Well, that's a very good question. The GTA IMS table was meeting 3 times a week, and I think we'll be upping that to 5 times a week. As well, there's a separate critical care command table that meets. So given that all hospitals are experiencing the same health human resources, it's much more difficult to provide that release valve to the same degree that we saw in previous waves. So I think a focus has been on trying to move ALC patients where that is possible. And I would say that we, although we may see and have experienced transfers to our sites, I'm very hopeful it won't be to the same degree as we experienced in previous waves.
Thank you, Nancy. And, really want to pause and just thank you so much for your leadership, for your dedication. I've worked with you a long time now, and you remain extraordinarily calm always and positive. So I'd say you're absolutely unflappable. Thank you.
Well, thank you, Janice.
The surge of COVID cases in Ontario is described as almost unfathomable by Ontario Hospital Association President Anthony Dale. Yet there has been a narrative that Omicron is less virulent with less severe impacts. So welcome, Dr. Kosovani. Are you concerned that the belief that Omicron isn't as serious, along with widespread vaccination, that maybe we've lulled people into a false sense of security?
Yeah, that could be true, but from early Ontario data shows that the rate of hospitalization and rate of death is 68% lower in Omicron compared to the Delta. But we have to know that we know already that we have much higher number of the Omicron cases. For example, if I remember right, in August or September, the rate of the cases in Simcoe County was around 10 patients per 100,000 population per week. Right now, we have 600 per 100,000 population per week. So it's a significant jump from 10 patients to 600 patients per 100,000 population per week. And as Nancy mentioned, although the severity is less, but the absolute number of the hospitalization and the effect on the healthcare system is much more significant compared to the Delta. So we cannot compare these two together.
Thanks, Severe. So perhaps less severe, but the volume, the numbers is just going to really not allow us to sort of appreciate that. So recently, the Chief Medical Officer of Health, Dr. Kieran Moore, predicted that this wave could peak by the end of January and begin a descent in February. So Amir, what do you predict?
So the data from South Africa shows the rate dropped very quickly. And in the UK, we also started seeing decreasing cases, but not as quick as South Africa. And we cannot compare our population to the South Africa because we have different population, we have different vaccination rate. But in some places in Ontario, like Kingston, they already reached their peak and the number of cases are dropping, the number of outbreaks are dropping, but still they have increasing rate of hospitalization. So Kingston was ahead of us in about 10 to 14 days. So in the next few weeks, we get better on that area. so we can see what's going on. The only thing is that with the opening of the school, we may see a bit of an increased number of the cases in the next few weeks. So again, very difficult to predict.
Thanks, Amir. I think you were breaking up a little, but as I heard you say, in the next few weeks, we could begin to see a decline, but then with the reintroduction of schools opening, there could be a bit of an uptick blip in that as well. Is that what I heard?
Yes.
Thank you. So keeping Team RVH, our patients, and of course our families safe is our top concern. So Amir, from an IPAC perspective, what are you doing differently? How, given how easily Omicron is spread, what do we need to do and have to keep doing?
So we increase our surveillance. We keep updating our policies of IPAC policies, and we keep updating on constant basis our case contact and outbreak management. I can give you some example. For example, for the first time, for the visitors who are visiting NICU, because of the high risk of the outbreak in NICU, we are going to ask them to do rapid antigen testing them. And if they are negative before visit, they can come to the hospital and visit their baby. And if they are positive, they are not allowed to come to the hospital. This is the first time we are going to start this rapid testing for the visitors. Another example I can give you is a case and contact management and outbreak management. I can tell you, for example, because if your family member, family member are sick, based on the new priority definition, they are not qualified for the testing. But our occupational health, we decided if your family member are sick and you are going for a test, we hand 2 rapid tests to you, so you can use it for your family member to get tested, so you know your family member are negative or positive, so you get a better idea how to do our case and contact management. And these are ongoing problems, the outbreaks. We are updating our outbreak and contact management on a regular basis. Then the other thing the staff can do that, I'm sure lots of them, they get their booster dose for the vaccine, but I just want at this time to encourage them to get, if not, please get your booster vaccine as soon as possible. It has a huge effect on the decrease of the hospitalization and the number of case numbers.
Thanks very much, Amir. And really, it's about staying on top of the information that we're always sharing, but people have to read it, really ask their one-up manager, making sure they're current, so they know how to best protect themselves, obviously our patients and their families. So thank you for that. The town hall is also an opportunity for me, Amir, to just recognize the enormous pressure you've been under for almost 2 years now. Throughout this pandemic, we continue to rely on your expertise to ensure both our patients and Team RVH are safe. I can't imagine the number of complex questions you receive every day, and every day you thoughtfully and from an evidence-informed perspective respond. So we're really grateful for your expertise and commitment. Thanks, Amir.
Thank you, Janice.
Despite everyone's best efforts, Omicron continues to impact our staff and physicians. 2/3 of our total Team RVH positive cases throughout the pandemic have happened in the past 3 weeks. 2/3 in the past 3 weeks. In that time, the number of absent staff and physicians has increased 5-fold. So welcome, Daryl. What's the situation today, and just how significant is the staffing shortage? Daryl, I think you might be on mute.
I can't believe in 2022. You got me. Thank you. Yeah, if I can, thanks, Janice. If I may, I just want to extend my appreciation to the hundreds of employees and credentialed staff who are stepping up on a daily basis to assist their colleagues with their ability to provide care to our patients and our community. Thank you so much for remaining flexible and being available to work not only your regular shifts, but alternate shifts and in alternate roles as required. So as of this morning, recognizing these numbers shift by the hour, but at 8:30 this morning, Team RVH have 156 active positive cases. We also have 134 members of Team RVH who are determined as exposures, of which 74 of those 134 are off work at this time, leaving 60 who are still able to work remotely. This equates to a total of 230 members of Team RVH unable to work or practice at this time due to COVID-19 related reasons. And if you do the math, at 230 over about 3,500 active members of Team RVH, about 6.5% of our workforce are unable to work or practice at this time for this reason.
That's significant. So Daryl, what are some of the strategies we've implemented to manage the shortage and also ensure safe staffing levels?
Well, the list is long, Janice, but you know, our RVH is literally leaving no stone unturned. So just a few of the highlights. We have continued to have incredible success attracting talented individuals to join Team RVH. Over the last 4 months alone, we've attracted 320 new people. Now we've had some people leave, about 242, but that's a net increase of 78 individuals to join Team RVH. Also, RVH are fully availing ourselves of any provincial HHR programs that are made available to us. For example, we have 65 externs on site as helping hands, and these are final year students, so hopefully we'll be able to retain them when they become registered. RVH, as Dr. Amir Kosabani said, through Pure Health, we're offering the booster shots to Team RVH. These are RVH clinics only for our Team RVH, so you know it's your best defense against Omicron to stay healthy and well, so that you are available to come in and work your shifts. So please, once you get your booster shot, please send that into OC Health and Wellness. And the current stats, we know that it's probably based on the number of individuals who have not yet submitted their proof to OC Health, but active staff sits at 34% with booster and active credentialed staff at 19. So we know there's a lot of people who have gotten their booster but haven't submitted yet. On a daily basis, our leadership team is assessing the workload of their departments, reviewing the volume and acuity of patients against staffing levels, and offering overtime as required under our contracts. Often multiple times a day, our deployment meetings are taking place to match the supply of HHR with our highest priority needs. We know that our leaders, as required, are adjusting to alternate models of care, including team-based nursing. And where appropriate and necessary, leaders are able to determine criticality of individuals on a case-by-case basis to determine and consider whether an early return to work for those individuals who are isolating from an exposure is acceptable and appropriate, again, determining criticality and ensuring, of course, all PPE, IPAC, and public health protocols are adhered to upon return to the workplace. And lastly, if required, leaders may reach out and ask individuals who are scheduled for time off to volunteer to postpone their vacations to assist the organization. And as an absolute last resort, if absolutely required, some vacation cancellations may need to occur. However, I'm not aware of any situations where that's happened at this time, Janice.
Thanks very much, Daryl. Very comprehensive list. Now you've already, a great way to start. You thank those who are helping and really trying to assist wherever they can to make sure we keep the organization moving forward. But what is the message of Team RVH overall?
Well, we're already starting to see, and Nancy touched on this a little bit, we're starting to see the number of individuals who've completed their 10-day of isolation period returning back to full duties. So this is some much needed relief. Of course, there are some new positive or exposure cases related to outbreaks or home and community exposures that require new periods of isolation. So we hope we can get ahead of the curve. It's a bit of a timing thing. And as Amir said, or Dr. Kosabani said, that we're not out of this yet. Maybe by the end of January, first part of February, we'll start to see some brighter days. Also, Tanya Cripps and the HR team, along with the staffing officer, working very closely together, often multiple times per day, 7 days a week, with our leadership group to review our regular supply of HHR to match with our highest priority needs. Along with a previous list of initiatives that I shared, we're continuing to monitor all government sources for any change in guidance documents for early return to work following exposure or any other sources of HHR relief that may be available to hospitals.
Thanks very much, Daryl. So again, it's we can get ahead of this curve, but let's assume that the rate of infection amongst our staff and physicians continues. What do you see in the next few weeks? What do the next few weeks hold for us, Daryl?
Well, as I said, Janice, if we start to see more folks coming back after isolation period than are going off, we'll be getting ahead of the curve. We'll be getting that much needed relief back in our HHR supply. And we'll continue to look to any sources. We've already ramped down in some administrative and other areas to free up down to core level, to free up individuals to be those additional sets of helping hands. We're maximizing our externs, et cetera. So we're really looking to any source of HHR supply to help get us through these next few weeks.
Thanks, Josh. We're not out of the woods yet. We need everyone to continue to be flexible and available wherever possible. And the school opening on Monday could also have a negative impact. So we'll see, but that's really is a good message for Team RVH. It's my opportunity, Daryl, to also thank you for your leadership and commitment. You bring so much experience and know-how, and I'm really grateful that you're our Chief Human Resources Officer at this time. Special shout out to your team, Tanya Cripps. She's doing a tremendous job working and leading our deployment strategy, combined with the leadership of Kathy and Lee and Kareen, focused on all things OC health and wellness. So you and your team continue to work tirelessly every day to ensure that RVH has enough resources to provide safe care to our patients. So thank you very much.
Yeah.
We continue to see significant changes to provincial guidelines and directives for things like PPE use, testing availability, exposure direction. The onslaught of new information has been dizzying, to say the least. I mean, people want to do the right thing, but it is confusing. So Kathy, let's simplify things a little. What do people need to keep in mind if they're feeling ill or have been exposed to COVID-19?
Well, you just nailed it, Janice. It is a very dynamic situation, and our guidance for that very question has changed a couple of times over the last few weeks. So I'm going to simplify it for exactly where we are today. But just remember that the most up-to-the-minute guidance is, you can get a link to that from J&J, and it is that quick reference chart. So as of today, the most important thing, if you are sick, if you cannot pass the attestation, you need to stay home. And if you are staying home, that also will mean you will need to have a PCR test, and you should go for that as soon as you possibly can. Now, if you are having to be off because you have symptoms, you need to let staffing know, of course, your leader, and in every scenario that I'm going to talk about, you need to email our occupational health team. And I'm only going to give that out once as opposed to repeating it multiple times, but it is rvhohw@rvh.on.ca. If you have had a positive PCR, because perhaps you were asked to go for one for surveillance reasons, or if you've had a positive rapid antigen test, the same thing applies. You must stay home. Occupational health will connect with you as quickly as possible and give you some further instruction and guidance on exactly what that means and for how long you need to be off. There are a few different exposure scenarios, and I'm going to highlight the ones that we're seeing the most frequently. So if you have a family member who has symptoms but has not had any kind of a test, you can continue coming to work while they're getting a test, and I'll talk about that in a second. But you will be on work restrictions, and again, you will need to get a PCR. So connect with your OC Health person, email that email address, and they will give you some more guidance and instruction. In that case where you have a family member with symptoms, the way to get them a rapid antigen test is for you to go for your PCR. And Dr. Khosravani mentioned this a minute ago. When you yourself go for a PCR and you let our testing team know that you have a family member with symptoms, they will give you 2 rapid antigen tests for each symptomatic family member. So make sure you give that information out. If you've had a family member who's gotten one of those rapid antigen tests and it has been positive, no surprise here, you're going to have to stay home. Again, let your leader, staffing know, and also email occupational health. If you've had a community exposure, so not someone that lives in your own household, you can still come to work under work restrictions. You will need, though, no surprise, a PCR. And again, notify occupational health, and they will give you some additional information. And that's a change from a couple of weeks ago. A couple of weeks ago, we were having people stay home that have had a community exposure. So that's some new information. And also new is if you have someone who lives in your household with you and they've had a community exposure, that's really not going to impact you. You can keep coming to work under just normal everyday work conditions, but monitor yourself for symptoms.
That is a lot of information, Kathy. As you said, there's always the link, and we really encourage people to keep current and review it on a regular basis through the J&J. Now, recently there have been new testing criteria to focus on prioritized populations, meaning sometimes the PCR test is not available to most people. So Kathy, can you remind us of the current provincial criteria and how that impacts health workers, family members? For instance, the question often is, what do I do if my child has symptoms?
Yes, those are really good questions. And it is, I know, frustrating to some folks that their family member can't currently get a PCR test. And that's true for the vast majority of our family members. There will be some who meet the high risk medical condition criteria. I think if you have a family member that meets those conditions, you will already know. But for most of us, that's not the case. So again, if you have a family member, a child in particular, who it's very tough as parents to isolate from our sick children, you need to get a PCR. And again, when you go to get your PCR, we're going to give you 2 rapid antigen tests for that sick child. And that will help you to know if the child tests positive, that there will be some further steps you need to take.
Okay, thanks, Kathy. So RVH is now providing on-site swabbing for staff associated with potential outbreaks. So Kathy, can you give us more details about who is eligible to be tested there and where, and how they book an appointment?
That is actually something quite new. So we just opened this new testing site here in the main building this past weekend. But it is restricted to a specific subset of our staff. So this is specifically for staff who are here at work and become symptomatic, or if you are here at work and you are part of swabbing related to an outbreak, or if you have come back from an exposure and you still need additional PCRs and you are here at work. So the theme there is if you are here at work. If you need a PCR test and you are not at work, we still need you to go to Sperling. So the testing site here is located on level 1 in the Fracture Clinic corridor. If you're not familiar with that description, it's just in behind Tim Hortons. If you've been here a while, it's specifically behind where Jugo Juice used to be. And you can book that appointment through the link that Jane Cocking sent out yesterday. It will also be in the J&J, and it is appointment only. So if you just show up at the door, you will be disappointed. You do need to go and book an appointment. The appointments are all daytime hours from early in the morning until about 2 p.m.
Thanks so much, Kathy. Important information. We're trying to make it as accessible as possible for the team, any member of Team RVH who this applies to while they're on site. So hopefully that's being some help. That being said, Team RVH is utterly exhausted. Emotions are running high and demands keep increasing. So Kathy, what can we do now to bring some calm and peace back into our workday? How can we keep the spirit of kindness to each other, of course, to our patients? How do we keep that spirit of kindness alive during these difficult times?
Well, there's a couple of things. And I think the first thing that's so important is to recognize that it is okay to say that you're not okay. And sometimes just saying that out loud to another person makes a huge difference. It's like letting go a relief valve on a pressure cooker, just admitting, boy, I am tired and I am frustrated. Just allow yourself to be okay with feeling that way. And then I want to highlight 3 things. I talk about them every time, and they sound so simple as to be almost insulting, but I know most of us aren't doing them. So the first one is rest when you can. When it's your day off and it's your turn to rest, take that opportunity. We need you to rest and refresh and recover so that when you come back on site, you're ready to replace the next person who needs a turn to rest. The second one is about healthy eating. When we are really highly stressed, as we all are right now, our body fools us into thinking that we're starving. And that causes us to reach for things that are high in carbs, high in sugar, high in fat, exactly what we know we shouldn't be eating. And I've said before, the easiest way to address that is to pack your healthy food with you in the morning. Well, I don't know if you're like me, but right now I'm don't really feel I have the energy to pack a healthy bunch of food in the morning. This might be a chance for you if you've got kids to get your kids to pack your lunch for a change. See how that might work in your own family, just to inject a little bit of fun into it. Who knows what you might get, but I think it might be a way to work together as a family to help mom or dad as they're going out the door. And then the third one is about getting outside. And I don't mean just, running to your car to and from work. I mean, taking 5 or 10 minutes just to do a bit of a walk outside. It's really simple. And even if you have to force yourself to do it, it makes a difference. And then I wanted to really focus in on that word kind and kindness, because some of us are struggling with that right now. And I've heard that from lots of you, that you're not feeling kind. You're feeling frustrated, and your own exhaustion is causing you to feel less tolerant of others than you otherwise might. And I'm just going to talk a little bit about what some tips are for doing a better job at being kind. And one of them is something I use myself, and I know a few of my colleagues are using. And I have this taped on my monitor right underneath my camera because I'm on so many online meetings. And it's an acronym. It's really easy. The acronym is WAIT. And that stands for Why Am I Talking? And it's a reminder to just listen more, to breathe more, and to allow yourself a moment of stillness. And when you take that moment to wonder why you are talking, it really lets you hone into the other person's situation. None of us can know anybody else's complete circumstances, their fears, their own level of fatigue, or what they're dealing with at home or with family. So just taking that moment of stillness to listen and to pause before jumping in with something that you might regret and that might not represent the kindness that you really deep in your soul want to be able to exhibit to others.
Excellent advice, Kathy. I know what's going up on my monitor this afternoon. So it's rest when you can, eat properly, simple exercise, and wait. Why am I talking? Fantastic. Thank you very, very much. And Kathy, also thank you for your leadership. You're another stalwart leader who on a daily basis has to juggle so many priorities in your diverse portfolio. So thank you very much. I recognize Team RVH is under enormous pressure now more than ever. So as Kathy said, and we all say, please support and try to be kind to one another. As always, I'll close out this town hall with a patient letter and a reminder of the important work we all do and acknowledge that this team certainly lives the RVH values. I recently underwent a miraculous colon surgery procedure led by Dr. Bharat Sharma. I want to thank all of the staff that attended to me throughout my stay in a most caring, compassionate, and professional manner. If being in a hospital can ever be considered enjoyable, this experience was definitely one for the books. My recovery is speeding along, mostly thanks to the positive attitude that was instilled in me by the staff. You're all truly gifted and remarkable people. Cheers to surviving another year in these troubled times, Michael W. Well, that letter actually gives me shivers because when you go over it, you see all of the values in action and how hard this team was working to make sure Michael had a good experience. So thank you to the team for continuing to focus on the patient experience despite the pressures that you all face. One of the toughest aspects of the pandemic has been working without our beloved volunteers by our side. However, they continue to be here in spirit and support us in many ways, whether it's through the 50-50 draw or knitting for our patients. So I have another special letter today for our Blue Brigade. I'm a cancer patient at RVH and attend the chemo lab every 2 weeks before Christmas. I was offered my pick of many beautifully knitted blankets. The one I chose matches my room and it is gorgeous. I want to say how grateful I am for this gift and thank all the volunteers who take the time and put their love into making these. Happy New Year to all, Betty C. So on these chilly winter days, it's so nice to have a warm story of how our volunteers are still caring for our patients, even if they can't be in the building. We miss our volunteers dearly and look forward to the day when our hallways are filled with their blue vests and kind smiles. I doubt many of us expected to still be in this pandemic, and I recognize that after almost 2 years, you are bone weary and have days when it feels like you have nothing left to give. Unfortunately, the reality is that much will be demanded of us all in the next few weeks, and we must continue to work together to provide the same safe, compassionate care that RVH is known for. Remember, every day we assess the status of RVH as a whole. As was said earlier today, this situation changes hour by hour. So today your unit or department may be functioning smoothly while another is in crisis. So we all need to be nimble and flexible and rally together to get through this. And I recognize the pressures at work and at home are enormous, but please know that I have complete confidence in the skill, knowledge, and commitment of Team RVH. If you're overwhelmed or feeling anxious, please speak with your leader. And don't forget your colleagues on the RISE team are also volunteering their time to be there to talk if you just need someone to listen. We are Team RVH, and thanks to all of you, this is an amazing place to work, to practice, and to receive care. And so together, we will get through this. So please stay safe and stay strong, Team RVH. Till the next time.